Hi, you're watching Hindustan Times. I am Aditi Prasad. Now, till about a month ago, India had thought that she had won the war against COVID. When the first wave ended last year, it appeared as though India's COVID response, barring a few hiccups like the migrant crisis, had actually worked. The union government imposed a 68-day lockdown, citizens abided, and the central and the state governments used that time to strengthen the healthcare infrastructure, stocked up on ventilators, PPE kits, planned and initiated the vaccine drive. And by mid-February, it seemed that India had weathered the COVID storm with its vaccine program well underway. And then the second wave hit. To say that we as a nation were caught unawares about this second COVID tsunami will be an understatement. At the government level, both central and state governments, we had dropped the guard. Politicians held mega election rallies, states delayed putting in place curbs that would have prevented spikes in infections, and people like you and me, we had started partying and vacationing, thinking the worst was behind us. The wake-up call actually came only when the COVID-19 caseload really spiked to a worrying high. Overcrowded hospitals started raising oxygen SOSs, even turning patients away for lack of beds. The tragic death of at least 20 COVID patients at the Jaipur Golden Hospital in northwest Delhi was following a dip in oxygen pressure at the facility, and it actually highlighted the scarcity. Heartbreaking visuals of mass cremations in Delhi, in Uttar Pradesh, in Madhya Pradesh, in Gujarat exacerbated the ugly face of this ongoing pandemic. Over the last several days, however, there's been anger and demands that the central government really ensure adequate oxygen supply. The center has since swung into action. Here's a look at the urgent steps initiated to address the shortage so that at least India does not lose more lives for lack of access to treatment from the virus itself. Step number one. The center has now banned non-medical use of liquid oxygen. In order to ease the oxygen supply situation at hospitals treating COVID patients, the government on Sunday restricted the use of liquid oxygen to only medical use. The order also applies to the existing stock of liquid oxygen with the respective manufacturing units. The government, in its order, has clarified that no industry will be exempt from this order. Again on Sunday, the center approved allocation of funds for the installation of 551 dedicated pressure swing absorption medical oxygen generation plants. Now, these will be installed inside public health facilities across the countries. These plants will be established in identified government hospitals in respective district headquarters. The Union Health Ministry on Sunday also issued local containment guidelines for districts that have reported a test positivity of 10% or more in the last 1 week, or have more than 60% occupancy of oxygen supported or ICU beds. Now, the ministry has stressed on local containment zones for 14 days with clear boundaries and stringent controls to stop the spread of the virus. Meanwhile, Indian Railways has stepped up operations of the oxygen express trains to transport liquid medical oxygen to various states across the country. Now, an oxygen express train carrying about 70 tons of medical oxygen from the Jindal Steelworks plant in Raigad is expected to reach Delhi by tonight. Now, more such plans are being chalked out to ferry oxygen to the national capital, which is really starved for oxygen. The Navy has also kicked off oxygen express ferries to island territories. On Sunday, INS Sharda, it transferred essential medical supplies to the Lakshadweep administration, including 35 oxygen cylinders, rapid antigen detection test kits, PPE gear, masks, and some other items. Now, the IAF, the Indian Air Force, has also been airlifting oxygen containers to filling stations to tackle this ongoing oxygen emergency in the country. The Indo-Tibetan Border Police also has today reopened its COVID care center in South Delhi with 500 oxygenated beds. Now, remember, this facility was one of the largest COVID care centers across the world, but it closed down in February this year. The facility has now been reopened on the request of Delhi government to the Home Ministry. And finally, international support. Over the last 24 hours, the United States, Germany, UK, and the European Union have all shared their respective plans to provide assistance to India which in battling this crazy pandemic. While the US has agreed to send raw materials needed for vaccine production in India, the UK has also announced sending life-saving medical equipment, including ventilators and oxygen concentrator devices. Now, some experts are of the view that these urgent measures are coming a little late in the day, and we should have been better prepared for this second wave. But we will have time for recriminations and blame games later. Right now, the need of the hour is to step up as a collective to battle this massive spike in cases and save as many lives as possible. Till then, you stay home, stay safe, and stay tuned to HindustanTimes.com for all the latest updates.